A new study finds total knee replacements are more successful when performed with the help of a surgical robot. Currently, most procedures are completed manually. The surgeon, using their training and experience, determines how much bone to remove. But a growing number of TKRs are being done with the help of surgical robots that use pre-operative imaging to find anatomical markers for cutting. Researchers compared the accuracy, safety, and outcomes from 500,000 patients who received conventional TKRs and more than 17,000 who received robotic TKRs. The results showed patients who underwent robotic knee replacements had shorter hospital stays and fewer complications, such as infections, blood loss, fractures, dislocations, or mechanical complications. The one possible downside? The robotic procedure costs an average of $2,400 more, but the lead author says they may be more cost-effective when factoring in savings from reduced complications. He says, as the population continues to age, there will be a greater demand for safe and effective total knee replacement surgery.